Hello, everyone. This is Dr. Hart, and I am going to do a short video on what's it like in your first uh, clinical rotation, your mental health clinical rotation, what to expect, some of the things that are very important safety issues, safety things for you to think about as you're going into your first clinical rotation. That is where you're going into a psychiatric mental health unit. So it's important to identify signs and symptoms of agitation and escalation so that the environment is kept safe for everyone, including students, nurses, and people working in the facility. So the environmental safety, I'm going to talk about the a safety check for the therapeutic environment. I'm going to talk about the yellow flags that show and demonstrate to you as a student in the patient's behavior that are going to show you that you can identify those in the patient's behavior before they escalate and become more of a problem. Then I'm going to talk about practical verbal de-escalation and the do's and don'ts for the clinical floor once you get there. So everyone is nervous when they're first going into a psych rotation at your nursing school. Keeping these foundations or learning these foundations will help you to master your skills, and it will keep you safe and everyone safe around you. So I'm going to cover your fears, what they might be. You can put in the comments what your fears are, and I'll certainly give a response to those. The environmental safety at the unit, the environmental escalation scale going from the yellow flags to the red flags, your verbal de-escalation toolkit, which I can put in the link below this video, and what are the key takeaways for your clinical environment, your clinical experience. So the environment is the therapeutic area. So every time you enter a patient's room, you want to run through this mental checklist, okay, regarding the patient's rooms. Please don't ever go into a patient's room by yourself. Always take one of the behavioral health techs or a nurse or any other staff with you into the patient's room. While you're in the room, watch for obstacles. Watch for cord. Well, you're not going to see in the patient's rooms in a psych unit are very different from what you're going to see on a med-surg floor. You're not going to see, since these patients are generally medically stable, you're not going to see an IV pole with the cords running all over the place. The patients generally don't have cords in their rooms, because if you have a patient who is at risk of harming themselves or others, they may try to use that cord to hurt themselves. So there's no cords generally, but you still want to check and make sure the path is clear. If you need to make a quick exit from the patient's room, make sure there is nothing blocking you from getting to the door. So make sure the patient doesn't put themselves between you and the door just to keep you safe. Possible projectiles. So in the common area, I'm going to talk about a little bit more. The common area is where there's generally a flat screen TV on the wall, maybe. The patients have tables and chairs they could sit at, and yes, the patients are allowed to come out of their rooms. A lot of students think, oh, maybe it's like a jail. Maybe they're not allowed to come out of the room. No, that's not true. Even if a patient is involuntarily admitted in the state of Florida, it's called a Bigger Act. Other states call it something different. In Florida, it's a 72-hour hold where the person has had an incident, usually at home or some other outside environment, where police have been contacted, and it has been determined that the patient is at risk of harming themselves or others. So they are put in a hold unit involuntarily, although even involuntary admissions, and I'll talk about this more when I get to some practice questions that I'm going to go over, even in involuntary admission, the patient still has patient rights. They still have the right to refuse, the right to a safe environment. They have the right to the least restrictive environment, unless they're at the risk of hurting themselves or other, and that's when they lose that right, and I'll talk more about that later on in future videos. Potential projectiles in the common area could be a phone, although the phones at this unit that I have taken many students into, the phones are on the walls. The patients are allowed to make phone calls. They're on the walls. Their time is limited where they can make calls, and the cord coming from the receiver from the phone is very short, so they are not able to wrap it around their neck. The tables and chairs are generally, at this unit I went to, are bolted down to the floor so that they can't pick up the tables and chairs and throw it at someone. If the lighting and environment is too stimulating, the nurse may ask if the patient wants to go to their room, dim the lights. If they are highly agitated, if they're in an anxious stage or in a panic attack stage. I'll talk about different mental health disorders in the future videos. If a patient is in the bipolar manic phase, they're going to be overstimulated, and they're going to be all over the place. They're going to be anxious, angry. Emotions are going to be labile, which means all over the place, up and down, sad, mad. So the patient may do better if they're in a low light environment. If you're in the psych unit with your clinical group and a fight breaks out or a patient begins to get aggressive, make your way to the nurse's station. That's your safe space. If you don't have a way to get in, just knock, and there's a window. I'm sure it's going to be all windows, all glass, so the nurses are going to see you and they're going to let you in. So a patient very rarely goes from 0 to crisis mode in 1 second. It's usually a yellow flag. There's usually yellow flags that demonstrate to you as a nurse or as a nursing student, and your goal is to catch that anxiety before it escalates and hits agitation. We want to keep our patients as calm as possible. We want to have them sitting calm when it's possible, making appropriate contact, and their posture is relaxed. As they become anxious, you may see little micro movements. They may begin to wring their hands. They're asking the same questions repeatedly. Where are my meds? I need to smoke. I need to get out of here. And they maybe asking those questions over and over again. So this is the nurse's cue to intervene. They may start raising their voice, and then now you're going into the red zone. This is where you may see pacing. When I see a patient pacing, that's an immediate indication to me that something is going on with that person. You may see a tightened jaw, fist, closed fists like that, a change in vocal pitch. They may become very loud at that point. So here are some of the do's and don'ts. Use a low monotone voice. Okay, my voice is generally very monotone anyway, so I work very well with these patients in these situations. I generally don't. It takes a lot for me to get excited and angry, so I'm pretty even scale most of the time. So a high pitch would signal a panic area or a panic agitation state. Give the patient more physical space. That's what you want to do. Sometimes 2 arms length is good. That way they don't feel threatened. Now here are the don'ts. Don't ask why questions. And you're going to see this in your NCLEX style practice questions that I'll go over. The nurse does not use why questions, such as, why don't you want to take your medication? Why are you yelling and screaming right now? Why are you asking to leave? Why are you acting that way? That's just going to increase their defensiveness. It's going to get them even more agitated. Okay, another thing I'll talk about more in mental health is there are 2 main types of communication. There is verbal communication, and then there's nonverbal communication. So the nonverbal, I talked about some of the verbal things that you shouldn't do. The nonverbal communication styles that you should avoid: don't fold your arms like this. That shows to the patient, I don't trust you. I know more than you. I don't trust what you're saying. You're not right. I'm right. I know more than you. I'm educated. You're not. Don't stand directly facing the patient. Kind of stand off to the side. Your physical posture is going to be opened with your hands at your sides, arms at your sides, hands open, palms open like that. The arms and legs should not be crossed. Okay, ask questions like, how can I help you? You're going to remind your patients you're in a safe place. You may need to repeat this a couple of times because when they're in an agitated state, they may not be listening to what you're saying, and you may have to say it a couple of times. You're in a safe place. Give the patient choices if they want to go into their room, lie down, take a nap, dim the lights. They can turn off the lights in their room and lay down to relax a little bit. They may want to, if they're able to, you can offer the cafeteria area. They can go and get a drink. 2 more don'ts for nurses. Don't act rush. Don't be looking at your watch like, I have 6 other patients to see, and that's just going to escalate their mood even more. And don't be agitated back. Escalation is going to your escalation of your voice, and you raising your voice and trying to talk over them is only going to agitate them even more. So try to avoid doing that. Okay, and so your safety and the safety of everyone around you depends on your ability to assess. Remember, assessment is the first step of the nursing process. Assessment. So you're going to assess your environment at all times in this kind of a unit. Any unit that you work in, even a med surg floor in a hospital, can have an escalated situation. Okay, and we've seen that in the past, right? Unfortunate things that have happened to nurses. Sometimes it's unavoidable, but sometimes you can, there is a possibility that you can de escalate. And if you have that opportunity, you should take advantage of it. You'll be more in control of your environment. Okay, and by the time the code is called in a psych unit or in this unit that I have taken students to, it's mainly a code gray, which is security. They're calling for security, code gray, code gray. So that means all staff, all behavioral health techs, and all nurses, all security, all doctors that are on the floor are going to show up at this area where there is a problem. And this is a show of force, and this lets the patient know that the people in the unit are in control, and they're going to do their best to de-escalate. They're going to work as a team to try to de-escalate the patient at this point. More about the common areas. I want to talk a little more about the common area. When I'm in this unit with the students, and it's breakfast time, and I want to take the students with me if possible. During breakfast time, they have a breakfast area, and this unit has an outside courtyard area where they can sit outside and eat, or they can sit inside. When you're walking with patients around you, always be mindful of your surroundings. And if possible, I tell the students, try and let most of the patients go before you. So that way they're walking in front of you, they're not walking behind you. Be aware of your behind situation. Your clothing, we're going to talk about clothing and uniform for a second. The students that I work with are not permitted to wear hoodies. The patient can grab the hood from behind you. No stethoscopes around the neck so that the patients can't use that as a weapon around you. No lanyards with the student ID. Student ID should be on one of those flexible things where it springs back. Different things for safety reasons. Okay, good shoes, solid shoes, and your basic whatever clinical uniform you use for your school. So that is all for now, and I am going to put a link with those checklists in the description below. If you found this video helpful, please like and subscribe. And I will be look out for more fundamental and mental health nursing breakdowns. And I'll see you in the next lecture.